Should you drop acid? And I'm just not talking about the old days of Timothy Leary. I'm talking about hydrochloric acid, stomach acid. Stomach acid replacement for some of us can be a real game changer. Most of us don't even consider acid unless we have heartburn, and then we assume we make too much acid. But it turns out that the majority of the cases of heartburn are actually due to too little acid. As we age over time, it's well documented that our cells that make stomach acid, the parietal cells, don't work as well. They poop out and we make less stomach acid, or they're very sensitive, just like the duodenal area is to celiac, to gluten proteins. We also think now that there's cross-reactivity of a lot of different things to the parietal cells, and they can be damaged with autoimmune issues. So as we age, many of us make less stomach acid. We need stomach acid to absorb our minerals down to the right valence state to get them inside the cell. We need stomach acid to fight off pathogens. We need them to help us remineralize our bones. Oftentimes we're not responding to meds when if we just had enough adequate stomach acid, we would be absorbing the minerals that help hold calcium in the bony matrix of the bone. Many different illnesses like irritable bowel syndrome, inflammatory bowel disease, or other non-responsive chronic illnesses can be improved if we improve our digestion. I always think as a medical nutritionist, at the top of the heap is absorption. Are you overeating but your cells are starving? Stomach acid is part of that proper way to absorb. The next level is dosage. Are you taking the right dosage? Because if you just take one pill and that wasn't really repleting all that you needed, then you might say, I tried it, but it didn't work for me. So at the top of the heap is absorption. At the next level is dosage. And underneath that, are you getting out all the things that competitively inhibit that? For example, are you on that purple pill for years and years? And is it blocking your acid when you really don't want that function to be happening? We now know that the proton pump inhibitors, the little purple pills, are linked to increased risk of fractures, at least for a hunk of a period of time. They're linked to lower levels of magnesium inside the cell. They're even linked to a bit of issue with the immune system because there's an increased risk of illnesses like pneumonia. So you can't really take a pill to tamp down your stomach acid for a long period of time and not have negative consequences. And oftentimes most of those people on those scripts actually aren't making enough stomach acid. So I hate to say this in a funny way, but I'm going to say it again. Maybe dropping acid might be the answer for you.